The Matching Features, Exercise 1. The paragraphs for this practice exercise is from a text called Giving Blood in a Time of Crisis from the World Health Organization, WHO, website. Read the questions, read the following text, and look for the important details. Prakash Gimire was just leaving his home in Kathmandu to travel to the airport when the shaking started. Within a minute, a massive 7.8 magnitude earthquake, the worst to strike the region in more than 80 years, had laid waste to large parts of the city, wreaking destruction that would leave about 9,000 people dead and another 22,000 injured. Half an hour later, Dr. Gimire, a national professional officer at WHO's country office in Nepal, was at the Health Ministry to join the team assembled at the Health Emergency Operations Center. He was put in charge of coordinating the blood transfusion services, including the availability of blood and blood products in earthquake response operations. Immediately after the earthquake, we assembled and started taking stock of what had happened, he says. An initial assessment revealed extensive damage to the nation's blood supply infrastructure. Out of about 100 blood transfusion centers, 9 were completely destroyed and 21 were partially damaged. The Central Blood Transfusion Service building in Kathmandu had large cracks in its walls and was deemed structurally unsound. There were also deaths and injuries at 2 of the sites carrying out blood collection activities that day. 1 Nepal Red Cross staff member, 1 volunteer and 7 donors had died, and others remained trapped in a collapsed donation center, awaiting rescue. But Nepal had long feared a devastating earthquake and had made some preparations. The country's first solar-powered emergency blood transfusion service center had been inaugurated just 5 days before the earthquake struck. The designers had predicted that power would be a significant problem after a natural disaster. The rooftop solar panels meant that this was not an issue. Match the features. Prakash Gimire. Dr. Gimire. Nepal. A nurse. B. Place of the earthquake. C. A doctor. D. A blood donor. E. Earthquake victim. Answers. Exercise 1 answers. 1. E. 2. C. 3. B. Review and strategy. The matching features questions are common in the IELTS reading test, therefore, you should practice and develop a strategy for answering. Tip: read the instructions before you start reading the text. Make sure you understand what the question is asking you to do. Tip: read the names or places first and scan the text to find them. You can underline or highlight them, they may be mentioned more than once. Tip: look for the connection between their name and what they have achieved, etc., that relates to the options. Be wary of synonyms and paraphrasing. Tip: choose your answers through an elimination process. Which ones do not fit? Which ones can you dismiss? Task: matching features. IELTS Reading Matching Sentence Endings 10. Matching Sentence Endings. Task: completing sentences by matching the start of the sentence with the correct ending given in a list. Skills: locating information in the passage, understanding information. Tips: read through the sentences and then read through the possible endings. Prepare paraphrases to find information in the passage. Choose the best ending to match the information in the passage. The completed sentence must be grammatically correct. Sentence beginnings follow the order of information in the passage. Answers are usually letters, A to G. Read instructions carefully to check. There are usually more endings given than you need. A compound in strawberries may prevent cognitive decline, research shows. A compound found in strawberries and other fruit may help prevent cognitive decline, new research shows. The findings may help prevent Alzheimer's and other neurodegenerative diseases associated with aging. Researchers at the Salk Institute for Biological Studies found that treating aging mouse models with Feistin, a compound found in strawberries, helped reduce brain inflammation and cognitive decline. The study, authored by Pamela Marr of the Cellular Neurobiology Laboratory at Salk, was published in the Journals of Gerontology Series A. Companies have put Feistin into various health products, but there hasn't been enough serious testing of the compound, said Marr. Based on our ongoing work, we think Feistin might be helpful as a preventative for many age-associated neurodegenerative diseases, not just Alzheimer's, and we'd like to encourage more rigorous study of it. Marr has been studying the compound for more than a decade. Previous research has found that Feistin reduced memory loss caused by Alzheimer's in mice, but that study was related to genetic Alzheimer's. This form of the disease only accounts for 1 to 3% of cases. In the team's most recent study, they fed the prematurely aging mice a daily dose of the compound in their food for 7 months. A separate group was fed the same food without Feistin. The team examined certain proteins associated with brain function, inflammation and stress response. After 10 months, Marr said the differences between the two groups was striking. Mice fed the Feistin compound had no noticeable differences in their behavior, inflammatory markers or cognitive ability. The group that was not fed Feistin had elevated markers of inflammation and stress, and had difficulty with cognitive tests. The researchers found no acute toxicity in mice treated with Feistin, even when given high doses of the compound. While Marr acknowledges that mice are not people, she is confident that there are enough similarities to warrant a closer look at the compound. We think Feistin warrants a closer look, not only for potentially treating sporadic AD, but also for reducing some of the cognitive effects associated with aging, generally, said Marr. The next step, Marr hopes, is to partner with another company or group to conduct human trials of the compound. Feistin is currently sold as a dietary supplement, but those products are not regulated by the FDA. The team has also developed derivatives of the compound that may have enhanced properties, Marr says. One of the advantages of those is that you can patent them, she said. The disadvantage is that to get them into a clinic, you have to go through a lot more regulatory hurdles. Marr and her colleagues have also collaborated on research related to other cognitive protecting compounds. One of those compounds, J147, is almost ready for human testing. The paperwork is being filed with the Food and Drug Administration, FDA. The team is still in the negotiating phase of securing funding for a Phase 1 clinical trial. The J147 compound is derived from curcumin, a compound found in turmeric. If proven effective and safe, Feistin may be used to help prevent Alzheimer's and other forms of dementia, a growing problem as the world's population continues to age. Aging is, according to the United Nations Population Fund, UNFPA, one of the most significant trends of this century. 1 in 8 people in the world is over the age of 60. By 2050, UNFPA estimates that 22% of the population will be 60 and older. The Alzheimer's Association estimates that there are 5.5 million people living with Alzheimer's disease in the United States alone. Among those 5.5 million people, 5.3 million are 65 and older. Alzheimer's disease in older individuals is closely linked with other medical issues, such as incontinence, which requires caregivers to take on the additional tasks of changing bed pads and adult diapers. As researchers continue to learn more about compounds and their cognitive protecting properties, Alzheimer's cases may begin to decline. A decline in Alzheimer's and dementia may help reduce the expected shortage of medical care professionals needed to treat aging patients. The research team is currently trying to secure clinical human trials, but such treatments will likely not be available to the public for years. Questions 1 to 8. Complete each sentence with the correct ending A to J from the box below. Write only the letter. You do not need to use all of the sentence endings. A. To be over the age of 60 by the year 2050. B. May be described as a new superfood. C. To reduce swelling of an organ. D. An increasing problem around the world. E. Been studied for over 10 years. F. More testing should be carried out to find out the benefits of FIST. G. The predicted burden on health services in the future. H. Cure diseases suffered by the elderly. I. Controlled testing of FIST on people. J. Are highly toxic. See our answer guide. 1. H. 2. C. 3. F. 4. E. 5. I. 6. D. 7. A. 8. G. 1. Strawberries may help to cure diseases suffered by the elderly. We can see a paraphrase in the first paragraph: strawberries and other fruit may help prevent cognitive decline and prevent Alzheimer's and other neurodegenerative diseases associated with aging. 2. In non-human tests, FIST was shown to reduce swelling of an organ. The text says, FIST, a compound found in strawberries, helped reduce brain inflammation. Brain inflammation is a paraphrase of swelling of an organ. 3. Specialists believe more testing should be carried out to find out the benefits of FIST. This is a paraphrase of Maher's quote, "There hasn't been enough serious testing of the compound." 4. FIST has been studied for over 10 years. This is a paraphrase of the sentence, Maher has been studying the compound for more than a decade. 5. Maher wants to soon begin controlled testing of FIST on people. We can see the connections to this sentence. The next step, Maher hopes, is to partner with another company or group to conduct human trials of the compound. 6. Alzheimer's is an increasing problem around the world. The text states that FIST may be used to help prevent Alzheimer's and other forms of dementia, a growing problem as the world's population continues to age. 7. Almost a quarter of the world's population is predicted to be over the age of 60 by the year 2050. This is a paraphrase of by 2050, UNFPA estimates that 22% of the population will be 60 and older. 8. A reduction in the number of cases of cognitive diseases suffered by the elderly will reduce the predicted burden on health services in the future. We have many synonyms and paraphrasing here: reduction, decline, cognitive diseases/Alzheimer's and dementia, burden on health services, shortage of medical care. A decline in Alzheimer's and dementia may help reduce the expected shortage of medical care professionals needed to treat aging patients.